give us, the right now, at this moment in time, I was gonna introduce, but a little bit more about the, sorry, I do speak too fast. To tell us more about the context and history of why decriminal psychedelics is even a thing in the first place, like how does that emerge as its own sort of movement and policy, the history behind that, and then also to explore and to help frame the conversation a little bit, how that has developed, and also in the context of respect for indigenous cultures and how that's played out in the development of this becoming a thing and how we see it now. I'm going to share my microphone with you.
Thank you, Tamar. So in terms of the history and the context, I like to kind of speak from my own lived experience. So I got into drug policy reform 10 years ago as an intern at DPA, and I eventually got into psychedelics at a conference learning about influx treatments for psychedelics, and I remember speaking to a colleague of mine sometime later, and he said something like, oh yeah, the researchers purposely don't do policy work. And I was like, what do you mean? And he explained to me that a lot of researchers or a lot of institutions felt that doing political work will threaten the research's success. And so that is a big part of the history when it comes to psychedelic research for policy reform. There's been that kind of fragmented relationship. But at the same time, researchers have done a good job of mainstreaming their work in the media and controlling the narrative around it. And then there's also, like you mentioned, grassroots organizations like League for Nature. There's a lot of psychedelic societies that have popped up in most major cities nowadays. And so we start to see how the research and the mainstreaming has inspired a grassroots movement to create these ballot initiatives or changes on the local level. That said, there's been a lot of critiques of those movements for various reasons, but it goes to show that even though, in the early days the researchers were avoiding that policy work, their work ended up kind of spurring the grassroots movement in some ways. And the last thing I'll say is that sometimes research can act as a gatekeeper. So, yeah.
Thank you. Okay.
So,
I think two questions.
Yes. I forgot about the second question. So, to your second question about indigenous rights and respect to their medicines, I'm not indigenous, and I'm indigenous American, and Dawn Davis, the peyote scholar, can be here. She comes from that lineage, so I encourage everyone here to check out Dawn Davis's work, along with other indigenous scholars like Uriah Seligman from the Othering and Belonging Institute, and Christine McLeave, and cultural workers like Belinda Ariacho. That said, I also have been pointing people to a piece that Uriah Seligman authored with a group of indigenous scholars that was in the Lancet. It's called Principles of Indigenous Medicine to Guide Psychedelic Research and Practice. And it is a really great piece that outlines 8 principles. And those 8 principles are reverence, respect, responsibility, relevance, regulation, reparation, restoration, and reconciliation. And it's just a really great resource that really explains the context of how a lot of indigenous folks see these medicines as opposed to the Western view. And I've been in rooms with some of these folks, and I guess the common thread would be that a lot of these medicines are seen as ancestors or relatives or living beings, and not just inanimate object like Western thinking. So I encourage folks to really sit with that. And, you know, most of us here are drug users of some sort, but I ask everyone to just kind of carry that with you and think about your substance use in a different way.
Thank you. Okay, now I'm going to go to Betty, and I want to ask, so one of the issues that we've